Okay, let's talk about refeeding syndrome because this is one of those sneaky NCLEX topics that can become life-threatening fast if you don't recognize it. Refeeding syndrome happens when a severely malnourished patient suddenly starts receiving nutrition again. Whether that's through tube feedings, TPN, or even oral intake, the body has basically been in starvation mode, so electrolytes are already depleted. And then once glucose and carbs are reintroduced, insulin suddenly increases and pushes electrolytes like phosphorus, potassium, and magnesium back into the cells. And this is where things can get dangerous because the hallmark electrolyte that you need to know for refeeding syndrome is hypophosphatemia. The NCLEX loves this, but patients can also develop hypokalemia and hypomagnesemia. So what happens clinically? Patients can develop weakness, arrhythmias, respiratory failure, seizures, confusion, heart failure, and even sudden cardiac arrest because these electrolytes are critical for muscle and cardiac function. The highest risk patients are those with anorexia, alcoholism, prolonged NPO status, severe weight loss, or chronic malnutrition. For your nursing priorities, the NCLEX wants you to recognize that nutrition should be restarted slowly, not aggressively. You need close monitoring of phosphorus, potassium, magnesium, glucose, cardiac rhythm, fluid balance, and signs of overload. The NCLEX also loves safety questions here because these patients are at a high risk for dysrhythmias and respiratory complications once the feeding starts. So your biggest takeaway is if a severely malnutritioned patient suddenly declines after nutrition is restarted, I want you to think refeeding syndrome and check those electrolytes immediately, especially phosphorus.